Dr. Rahul Bhargava, Director of Hematology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurugram. We are going to talk about amyloidosis. And amyloidosis, much is known about amyloidosis. It is of 13 types. The commonest type is of AL amyloidosis, like plasma cells. Plasma cells, if they are more in number, that's called plasma cell dyscrasia. But if they are different in size and form of the plasma cells, they form amyloidosis. So they get deposited in the kidneys, they get deposited in the heart, they get deposited in the nerves, and that's the symptom comes in. Tingling numbness, unexplained renal failure, cardiac dysfunctioning, where dyspnea is the commonest thing. That's why in the elderly side, you have to ask the cardiologist to look for amyloidosis, particularly patterns on the echocardiography. And amyloidosis people can present with any age. Generally, they are elderly side, 6th and 7th decade. That's where they tend to present with. So the amyloidosis has got multiple treatments. So for diagnosis. So how do you do that? You do a blood test, you do a serum protein electrophoresis, you do immunofixation test, you do an echo, you do a nerve biopsy, you do a bone marrow aspiration and biopsy, you do a fat bed biopsy, and yes, amyloidosis diagnosis will be made. And more advanced tests like mass spectrometry has to be done. Once that is done, you know what next to be done is the chemotherapy, which is again daratumumab based therapy, which is a targeted therapy for the plasma cells, because in this number of plasma cells are not more, but it's the plasma cells configuration which is less. So I think the DARA VC remains the cornerstone, and if the multiple organs are involved, you don't do a transplant, but if single organ are involved, you do bone marrow transplants in amyloidosis. So amyloidosis is a rare disorder and not many people knows about it. Please be aware of amyloidosis as a disease and stay tuned and get connected to us. Thank you.